in those states?
Well, bottom line is that we're not diagnosing enough cases and we're not tracing their contacts. We don't know how this disease is spreading in many places. We still don't understand who's at highest risk. Why are we having so many cases now, this many weeks into a plateau, or into various cases experiencing rising daily numbers? So I am concerned. I think there are some places in the country which are doing a lot better, which have low overall numbers and have had a 2-week decline in cases or more and have been doing a lot of testing. But there are other places which are really experiencing the opposite: rising cases, too little testing, too little tracing.
And what is the danger if you reopen in one of those states where the number of cases is still rising and you don't have enough testing, you don't have enough tracing? What's the danger then?
Well, the danger is that with increased social interaction in businesses or churches or in activities, going to restaurants, etc., that with increased social interaction, we will again see increased transmission and rising numbers of cases. And in states where they're already on the rise, that could put a lot of pressure on their healthcare system. That could lead to new hotspots. I mean, just to remember, 2 months ago in this country, we had 750 cases, and now we have well more than 1 million. So this disease moves quickly, and it doesn't respect city borders, state borders. So as states are reopening, we have to remember we're in a new normal. This isn't the way it was in February or March. This is a really nasty virus which remains the same. So we have to do all that we can as individuals. Even as businesses are reopening, we have to do all we can to maintain space, wear cloth masks, avoid gatherings. The virus hasn't changed. Those things are all still really important.
Let's talk about the nature of this virus. You say it's a nasty one. Here's what President Trump said this week about the pandemic.
I feel about vaccines like I feel about tests. This is going to go away without a vaccine. It's going to go away, and we're not going to see it again, hopefully, after a period of time.
Dr. Inglesby, will the virus, as the president said, just go away?
No, this virus isn't going to go away. Hopefully, over time, we'll learn to live with it, and we'll be able to reduce the risk of transmission. But it's going to stay as a background problem in the country and around the world until we have a vaccine. Hopefully, as we develop medicines, maybe more quickly than a vaccine, that will help us in ways to diminish the impact of the virus. But this virus, we're mostly around the world, almost all of us are susceptible to it as far as we know at this point. So this virus has a long way to run. We don't think that more than a small percent of the country at this point has been infected. So most of us are still susceptible to this virus.
What about the argument you hear from some people? Look, the people who are dying from this virus are seniors, people over 60, or people with underlying conditions. So just quarantine them, or have them isolated, and let the rest of the people go back to work. Would that work?
So if you add up the number of people in the country over age 65 with all those who have underlying conditions that would put them at higher risk, that's about 90 million adults, or a third of the adults in this country. And there really isn't any clear way to separate that third of adults with the rest of the country. So it would be pretty challenging. I mean, right now the country is already trying to do its best to prevent infections in nursing homes with stay-at-home orders around the country. And even with that, about half of the nursing homes in the country have a case or an outbreak. And so I think we need a kind of a strategy that works for everyone. I don't think there can be a strategy that works for only half the country and with an attempt to keep the other half or the other third of the country in some kind of large isolation. I don't think it'll work logistically or practically.
On the other hand, as I just discussed with Secretary of the Treasury Mnuchin, and as I'm sure you've seen, more than 30 million Americans have lost their jobs. Is there a way to find a balance between, on the one hand, saving people's lives, and on the other hand, saving our economy?
We absolutely have to find that balance. I completely agree with you. The economic losses in this country are shocking. And our team at our center wrote one of the first reports on reopening the economy. We believe strongly that that needs to be a near-term goal. We just have to do it in a way that is as safe as possible. I completely agree with that principle articulated by Secretary Mnuchin. We have to do it safely. And I think that means trying to have very, very substantial diagnostic testing capability in place around the country, the ability to trace the contacts of patients. That's how other countries in the world have gotten control of their epidemics. The way that they've restored their economies really is to give people a sense of confidence, I think, that the disease is under control or relatively good control, and I think that should be our goal here. We have to show people that this disease is under good control, and people will then have confidence in going out and re-engaging the economy. So we need to build contact tracing capability around the country in every state. We need to expand diagnostic capacity in every state.
Right.
And that's the way I think we're going to get control.
Dr. Inglesby, thank you. Thanks for coming in again to discuss the hard scientific data with us. Thank you.